There we go.
Okay, there we go. So welcome to the Windsor Southeast Supervisory Union board meeting. It was called for 6:30, so I'm calling it officially to order. And I believe that because we have all been in multiple meetings in the past few days, and we need to come to a consensus on how our schools are going to open, that there will be no changes or additions unless, David, there's something that absolutely has to be added.
No, I think we're fine with
Okay.
the agenda as is.
Great, thank you. So moving on, just before everything gets started, so far I am seeing that there are 57 individuals signed on to this meeting. And I have a screen where I can see 16 people. So in order to make sure that if people have raised their hand or however they're hoping to get someone's attention, Elizabeth Burrows will be keeping an eye on the chat. If you wish to speak, please make that comment there that you wish to speak. And so this is a board meeting, and it's a public meeting, but it's a meeting of the board where the board needs to make decisions. We will allow for some input, but it's primarily the board who will be making these decisions. So if someone wishes to make a comment, please ask to do so in the chat, and you will be given 2 minutes. And Nicole will be keeping track of time, and she's not shy as far as interrupting and saying you have 10 seconds left. So without further ado, we will start with our first discussion item, reopening the school survey results.
Would you like me to share my screen? Amy, I have a slideshow that I can present.
I think that might help, Angie.
Yeah, that would be good. And also, Elizabeth just reminded me, she also put in the chat, if you are not speaking, please mute yourself because we get way too much feedback and hearing dogs barking and who knows what in the background. Thank you.
Just a moment, I'm just making some final edits. I duplicated a slide and it didn't work. Shoot. There you are. The school survey, school opening survey went out last week. We haven't shut it down, so are still results coming through. So because I can't see the chat, Amy, please interrupt me if you have a question, okay? So this is the survey data based on results through about 5 o'clock this afternoon. This child will return to in-person school. I'm going to read it for benefit for those that may be on the phone. So we had 1,058 responses. Probably about 10% of those are duplicate responses. I think some of those are some kind of glitch that happens with it, but also there were parents that submitted responses, say August 6th, and then August 10th, they had new information, and so they submitted another response. This data was taken from the survey directly, so it's slightly, it has a slight inaccuracy, but overall, the trend is the same. About 75% are saying they want to return to in-person school, and about 25% overall in the supervisory union would like a remote option or will be homeschooling through a Vermont AOE study, home study plan. This question went to people who had selected the in-person option. And what this slide is telling you is how people would feel about sending their child to school if we should have a local spike in COVID-19 cases. So the first one is in Windsor Southeast Supervisory Union, this right here. And then the second one is if we had a spike in neighboring school districts. And then the third is if it was in Windsor County. So the yeses and the nos, yes, I would send my child to school, or no, I will not send my child to school. So it seems that if we have a spike in cases locally in our supervisory union, parents are less likely to send their children to school. Are there any questions on this slide? Okay. Again, this survey result is for the transportation. I thought you might be interested in the number of families that would select school bus transportation. That's shown in the yellow, about 25%. And this 785 responses are of the families that chose the in-person option. The red is family provided transportation. The blue is they walk to school. This slide shows you the number of responses for families that would choose a remote only option. The blue represents families who are going to be filing or have filed a home study plan with the Vermont AOE, about roughly 13.5%. And the red represents the number of families that would request a school approved remote only learning plan or option. The data has been specifically broken out. That's supposed to say Windsor. That was the slide I was trying to fix, and apparently it didn't fix. This is Windsor Schools data. In the K-8 for Windsor, we had 140 responses. These totals are cleaned up data, so they're more accurate data. I had already gone through and removed any duplicates. 104 or 74% of those responses say yes, my child will return to in-person school. 36 or 26% said no, and 34 of those 36 are choosing a school remote only option. The 9-12 data, we had 190 responses. About 40% of those responses come from students with school choice. That data's not here, but I just remember it from the response slides. From the response data. 146 or 77% want an in-person option, and 23% or 44 want a remote only option, and 41 of those 44 want a school remote only option.
Angie, sorry, what was the percent what was the percent or the number of kids that are school choice in the 9 through 12?
So about 40% of these, 40%. Of this 190 are school choice kids. Albert Bridges data. 38 total responses, 82% of those were yeses, or 31. 18% were no's, and 2 of those 7 no's are opting for the school remote only option. Heartland's data. Heartland had 259 responses, 185 or 71% of those are returning to in-person instruction. 29% or 74 of those would like a remote only option, and 60 of those are choosing the school remote only option. At Weathersfield School, 202 total responses, 140 yeses, and that response is, indicates per child. Each family had to send a response in for each child. So 202 students, 140 of those are yeses, or 69%, and 31% or 62 are choosing a remote only option. Excuse me. And 55 of those are school remote option. Sorry, I'm gonna choke.
Angie, can you pause for
Sorry.
can you pause for a second, Angie?
Yes.
There. Sorry, are you okay?
I think so. I can't talk and breathe at the same time, apparently.
That's not a good thing.
I think I got the tickle. Sorry about that. Go ahead, Elizabeth.
We've got a question over in the text
Sure.
box, which I apologize. I was writing down the responses and I missed it, and that's my fault. I failed, but it says, I didn't see the question about local spikes in the cases. Was this not asked of parents using the remote option?
No, it wasn't asked of parents choosing the remote only option, because the question was about whether or not they would send their child to school.
Yeah, it was a dynamic question. I saw it.
If there aren't any questions about the school opening, the parent survey, I will talk a little bit about the staff survey.
Please do.
Okay. So in the staff survey results, I apologize and don't really understand what happened with our support staff responses, but we got about 4 times as many support staff responses as we have support staff. So it was very strange. We did get 107 total responses of teachers. So that seems accurate, but the support staff numbers were way off the chart. So I didn't even report those here because I felt like they skewed the data, that the data might've been skewed. So we had 6 Albert Bridge teachers, 23 Heartland, and 23 Weathersfield, and then 53 from Windsor, and 2 who teach at more than one school. So there are a couple questions from this survey that might be of interest to you. Given our school reopening plan, please rate your level of comfort with returning to work. And they had a scale from 1 to 4 to choose from. 1 was nothing will make me comfortable, and a 4 was I am very comfortable returning with this plan. Our staff came in at an average of 2.14, and the mode, or the response that was the most frequent in the data, was a 2. So so more than nothing will make me comfortable, but on the lower end of that scale. This breaks out the same data by school. So at ABS, the average score for those teachers was a 3. The average score at Heartland was a 2.04, Weathersfield 1.96, and Windsor 2.17. And the mode, Albert Bridge's mode was 3, Heartland, Weathersfield, and Windsor, their mode was 2. The top concerns that support staff and teachers reported: ability to keep physical distancing, air quality, room temperature, and these were, if any of these had a 3 or a 4, that means they were worried or very worried about this particular quality of in-person learning. Air quality or room temperature, and in the comments there were a lot of comments on protocols, safety protocols. How will I keep my room clean? Those sorts of things. The questions about the room temperature and maintaining that. Navigating my work and home safely through the pandemic. Lots of comments about my concern about their family members, caring for aging and ill parents and other family members. Is a big concern for many members of our staff. Wearing masks and face shields, that was a concern that the support staff also are concerned about. Managing so much trauma in students, and managing student and parent anxiety were the things that concerned our teachers most. I'm not saying there weren't more concerns, but these were the things that rose to the top on the survey. the comments were lengthy. I had 36 pages of them. You know, many about the logistics of teaching and the LMS and that sort of thing. So, what questions? Okay, that's it. Amy. I'm all set.
Yeah, just one other comment, Angie. First of all, thank you for all that work. That was a tremendous amount of work, and also disaggregating that data. The administrative team has looked at this several times in both surveys, and also the comments. I think the other piece with the comment is often about, and I think this goes with the logistics to some degree, you know, the ability to keep, you know, children masked and physically distanced. And we've never done that, right? I mean, if you walk through the buildings now, which are probably 75% ready to open. I did a walkthrough the other day with Jim Taft, and, you know, the desks are all in rows. They're all 6 feet apart. The room looks fairly austere. I mean, in terms of an environment, you know, we've, in some ways, for those of us who have spent the last 20 years trying to encourage, you know, collaboration and team building and you know, those kinds of project-based learning, which can still happen to a certain degree and outside. I think part of the anxiety on the part of teachers, just not, it's like entering the unknown. I mean, you haven't had to do this. I mean, some of us who maybe started our careers back in the 70s, 60s, I mean, we remember desks in rows, and we remember kids spaced, but this is not what we have been working on and training for in the last, 15 to 20 years. So I think there's a level of anxiety, and that showed up in some of the comments as well. And we heard at the last supervisory union meeting, you know, several of our teachers spoke up, and I think their comments and their fears and their anxieties are from the heart. And I think that they, you know, to their credit, you can see from the survey data, while worried, and we've been meeting faithfully with the union presidents. They'll return, or if they have some medically compromising situation, they'll apply for an ADA exemption or an ADA accommodation rather. And some of them have done that. Probably, I think about 4 of them have done that. And you know, the year hasn't started yet, so there may be a couple more of those. But in general, you know, I applaud the staff. They've been an integral part of creating this plan, particularly the union presidents. 2 from each of our districts have been spending hours and hours on calls with myself and with the administrative team more recently. And I just applaud their efforts too. I was on a call with my colleague Southeast superintendents, all the way from Brattleboro up to Hartford, and many of them are already, you know, receiving grievances from their unions, and I have to say that has not been the stance of our union. They've been very supportive, cooperative. They have lots of questions. We try to answer those questions, but we've tried to do this amicably and collaboratively, and I feel proud of every single one of those people, and thank them for the time they spent over the summer trying to help us put some of this together.
There are a number of questions over here. I'm going to read them to you one by one, Angie, okay? The first one is, after reading those, do you, Angie, feel that teachers are ready to return?
The fucking teachers.
I don't really feel comfortable answering that question because it was 107 of the teachers, and I think we have about 150. So that only really represents about 2/3 of our teaching staff. So it's hard to get a real accurate I think we can look at the trends in the data. We could probably draw some conclusions that we could support with the data, but I think it's still a stretch.
Thank you. Kristen McNamara, I think we will be discussing what our board members' reactions are, but not quite yet. Amy, Eric Nissenbaum would like to hear directly from the teachers. I don't know what your thoughts are about that. Amy?
Let's have some more conversation with the board first.
Okay. Kristen Hubner would like to thank you, Angie, for giving the teachers a chance to voice their concerns. And Angie and DeTurk would like to know whether board members will have a chance to read the comments. Yes. Okay.
Yes. Sorry, I was muted.
No,
I'll be sending them.
I read your yes. This question is, the next question is, will we have enough teachers willing to return to fill all in-person teaching slots? David, I think that question is for you.
That's in the chat box. Will we have enough personnel to fill all the in-person teaching slots? Was that the question?
Yeah, that's the question.
Yes, right now it looks like we will. And as a matter of fact, that's the big part of the next. We started it this week. It's the next part is getting all, classes assigned, all teachers assigned. The question was not about remote, the teachers who will be teaching the remote students, but that's a converse to that question. And we have not posted the remote job yet. We do have several people who have expressed interest, but we think we're going to be okay personnel wise with both the in-person and the 100% remote.
And then it looks like a couple of people would like to see, Angie, all of the comments, the teachers' comments as well as the parents' comments, if that's in the works.
Yes, the parent comments needed to be cleaned because in many of them they had mentioned their child's name. I also cleaned the staff survey data if it was identifiable, if they had personally identifiable information, I had to clean that. So yes, that will be shared with the board.
Thank you. Scott Richardson has his hand raised.
Thank you, Elizabeth. Maybe this was answered, but I just wanted to make sure we would all see the slides. And it started by saying that, but I missed it. So I hope the board members can see all those slides. I'm totally happy with Angie and any other school leaders' distillation of the comment content. So I don't need to read all that. But I'm glad to see the slides and not have to chart all that down. Thank you.
Let's see. Ann Steebing would like to know, can someone please explain the difference between the remote only option and the school approved remote only option?
I can explain that, Ann. So in the survey, parents were asked if they would be sending that child to in-person learning. And they said yes or no. When they said no, then we asked them if they had, what the plan was, the school plan was for that child. If they had filed a Vermont AOE home study plan, or if they wanted to take advantage of a remote only school approved remote only option.
Anne, I can't see you, so I hope that was good. If not, if you have any follow-up questions, I'd be glad to ask them. Next is Susan Hindinger. I apologize if I mispronounced your surname. Could you please clarify whether all students will be learning VTVLC curriculum or whether the in-person students will have Foundations, Eureka Math, etc., and the remote students VTVLC? Angie?
Should I take that, David?
Yeah, I think, yeah, you've got that curriculum perspective, and you know, you
Yes.
also had that meeting with that remote task force today. Yeah, I mean, I think you can, yeah, and if I need to, you know, say anything after you're done, that's fine, but I think
Okay.
it's good for you to take it.
So that I just want to put out there that changing curriculum in response to an emergency situation is not ever a good idea. That being said, because in this particular situation, we have to accommodate students who are at home learning, as well as students who may be in and out of the classroom due to their own illness or having to quarantine, and teachers who may be in and out of the classroom due to quarantine, illness or quarantining. We needed to come up with an option that would help our teachers teach in those situations. We also wanted to have some sort of continuity so that students that were participating in the remote only option came back to us when all this is said and done, and we all are back together in the classroom, that the learning gaps may have been mitigated in some way. So the teachers are going to be trained on the use of the Vermont Learning Cooperative's curriculum materials. That being said, those are customizable. So we're not, we have seen sample lessons, but until our teachers have the opportunity to get in and really see what the materials look like, they will then determine if there's a fit and if there's a place for Foundations, Eureka Math, Wheatley, and the programs that the other programs and materials that they've used for science, social studies, and other content areas. So we're hoping that by allowing our teachers to have the access to these materials, that they will spend less time preparing materials that were designed for in-person instruction and not for remote learning, and more time on instructional practices that are engaging and exciting for our students.
Just to back up what Angie said, and you did a great job explaining that, Angie. Susan, just to be clear, the platform, the new LMS platform is called Canvas, and the curriculum that's embedded in that Canvas platform is the VTVLC curriculum K-12, and our teachers are going to be trained in that Canvas platform and in the curriculum, with the understanding that we want to be able to have both the 100% remote students and the in-person students have a parallel curriculum, given that some teachers will, you know, create, just like they always do, certain pieces of it that will be their own. But it should be easy if, let's say, in January, where we have a vaccine, everybody goes back to school, they should have all been exposed to that same curriculum.
David, only because Nikki explained to me what happened, and so I have that insider scoop, and so does Amy. But can you please just explain to everybody else here when last we met, you all were talking about Calvert as a curriculum, and so we made a shift somewhere, and most of the rest of us didn't make that shift. So if you could just explain what happened in between the last meeting and now, I think that would be really helpful.
Yeah. Do you want me to take that, Angie?
I'm happy to talk about that.
Yeah.
So
Go ahead.
so it's been confusing because Vermont Virtual Learning Cooperative offered a couple scenarios. They offered the VTVLC collaborative schools option, which required us to loan a teacher to them for 1 year for this coming school year, and then allowed us to enroll a certain number of students in that curriculum to work with. It would either be our teachers or teachers who are also from around the state. The Vermont Virtual Learning Cooperative has a is being supported by the Vermont AOE. This is a partnership that they have for the for Vermont Learning, for VTVLC, to provide their curriculum and their use of their learning management system free to all schools. So at one board meeting, we explored another option with Calvert Learning. And what we really liked about Calvert Learning was it supported a project-based approach. And we felt that that's the direction that we wanted to go. And when we dug in deeper, it looked like the modules were very similar to what we were getting in Vermont Virtual Learning Cooperative. They use Florida's virtual school curriculum, which it's all standards aligned. So I don't think it's going to be a vast departure from what we have done in person in the past. It just, there might be some certain things that are different. For example, modeling in math, they might use some different models in Eureka Math versus what might be the models that they use in the virtual curriculum. The Calvert Learning was not cheap. And after the last board meeting, we got the sense that supporting that option was not really an option when we had a free option that we could go with. So then as we explored it more, the Calvert Learning was really best for our youngest students. We are still going to be using Seesaw, which is does have curriculum embedded in it and was very popular with our parents and our students of our youngest children. So that's still going to be an option. And the learning curve for that for teachers and students, from what I understand, is very shallow. So it's an easy platform to learn and to use for our youngest learners.
Thank you. Now there's a comment from Larry Dower and also one from Jennifer Aldrich for Ann Stiebing, clarifying that remote is, when we say remote learning at the AOE, we mean homeschooling versus what we've just talked about, the VTVLC, guided by teachers. Amy, Eric Nissenbaum would like to allow the teachers to have an opportunity to express their concerns. Beth Carter has a question regarding Canvas.
Yeah, no, I think you answered it. I was thinking it was Calvert, right? So I thought, okay, I thought we talked about it, right? So thank you for clarifying.
Yeah. Okay.
And I guess maybe I do have a question, Angie. So, or right, David. So Canvas can be used for the 25% of the kids that would be remote. But then if we go further, if there is a decision that we have to shut down officially, it could be expanded to 100%. Okay, good. Okay.
Okay, that is it for the comment box at the moment.
Yeah, just another comment on Canvas. It's more of a platform that allows for curriculum to be embedded and students can access it. It's what a lot of the colleges use. There's Canvas, there's Blackboard, there's Moodle, and Canvas is pretty user-friendly. At least from I use both that and Blackboard with college courses.
Amy, it's Elizabeth.
Yeah.
Do you want me to read you what comments are in the comment box? It just occurred to me, I'm supposed to be just pointing to people who have questions. I apologize, everybody, for reading the comments in the comment box. Which would you prefer?
I think that's fine.
Okay.
With the way you've been handling it.
Okay. Susan Hindinger, I apologize again if I've got your last name pronounced wrong, says, I'm concerned about middle level 100% remote students having only one teacher through VTVLC. I would be surprised if one middle school teacher would feel comfortable being and be qualified to teach 8th grade science, algebra, and 8th grade English, for example.
Yeah, I think that's a good question. And Angie, you can certainly back me up on this. This is what we have to understand about the Canvas platform and VTVLC. The teacher that's assigned is really a facilitator, a coach, a mentor. The teaching actually happens within the platform. So those students who are learning math or science or social studies will get live video demos from teachers who are teaching the concepts to them. And then the teacher would be there available for, for help, for support. And certainly if that teacher needed to reach out to somebody who was licensed in an area, they will be encouraged to do so. So I think it's just important to know that the VTVLC option and the 100% remote option it's very independent. I mean, there will be regular check-ins. So let's say you have a responsibility for, well, let's go to the middle level for 7th and 8th grade or 6th, 7th and 8th grade, and you've got those modules, loaded in. Then you would certainly have, daily interaction with the 6th grade and the 7th grade. You could break up your cohorts in that platform any way you wanted to, but the actual instruction would be guided. That's what's different about this program versus what we did in the spring. We had to create everything from scratch in the spring. This has it all loaded into the modules, and it's been rated and tested K to 12, and actually the 7 through 12 or 6 through 12 modules have been used for probably the last 10 years upon request. So they've been vetted pretty well. So I hope that helps, but it's much more facilitation than it is actual instruction or lesson planning.
I have a question on that. Will it be a lot of it asynchronous or synchronous?
Yeah, that's a great question. And I think given what I just said, there'll be a fair bit more asynchronous work for the 100% remote students. But again, always followed up, always, always. A matter of fact, there's an option in there for evaluation of some of that work. There's a regular, but I think it's going to be probably, 25% synchronous and 75% asynchronous. Angie, do you have a better answer to that question, basically?
Yes, I do. Yes, I do. As we're developing the plan for remote only, the amount of synchronous time is going to depend on the developmentally appropriate level of independence that we can expect from students. So I think the older the student, the more independent or self-directed learner that they are, the less synchronous time would be necessary. There will be direct instruction and direct support. We also want to have opportunities for those students to connect to other students who are also doing the remote only option. And we were talking today about our youngest students. We do have a fair number of kindergarten, 1st and 2nd grade students who would be part of this, and they're learning to read. So that does require a little more hands-on direct instruction. So it will vary based on, there's a lot of variables in that can affect how much support those children will need.
Mark Youngling has, I apologize, Mark, if I've mispronounced your name, has a good question, which is, do we have the tech support to directly instruct educators on the use of Canvas VTVLC and its expanded use should it become needed?
Yeah, I mean, Larry's on the phone, certainly, and I don't want to give him too big a head because he'll start asking for a raise, but I think we have the best tech department in the state of Vermont, quite frankly. And Larry has been working probably almost 24/7 getting us up and ready for this. Larry, I don't know if you want to talk about your ability to support this endeavor.
Yeah, I think if the main work would be in the upfront work, and once it's out and rolled out, which is what we're working on right now is the upfront work. Once it's out and rolled out, I'm fairly confident we can support this. The training, obviously, if we can get the teachers in the buildings for the training, especially those first couple of weeks of September, from August 27th to September 8th would make a huge difference. As much as that training could be on site would be great. And like to echo David's comments, it's not because of anything special I do. I got a great team. So between Mike, JD, Ryan, and David Lamb, we're going to be ready to support this. Another thing we're doing too is we will give more priority to Canvas teachers that are all in on Canvas. So those ones who want to use Google Classroom, we're not going to stop them, but they're not going to be given higher priority. So we're really going to work on making the curriculum work for those teachers. In addition, VTVLC has a contract with Canvas that will give them something that teachers have never had before, although they have it depending on the mood I'm in at night, is 24/7 support with an 800 number and a email address directly from Canvas. So if it's not something we can solve ourselves on our end, that's something, for example, they can't do today with PowerSchool. They can't call PowerSchool. Only we can call PowerSchool. It's part of our service agreement. So with Canvas, a teacher on a 3 p.m. on a Wednesday afternoon would be able to call Canvas and get tech support for Canvas if it's not something we can fix.
So you are already working on the embedding of the VTVLC with Canvas. Is that right?
Yeah, we're trying to prepare for so that we can hit the ground running if we can.
Excellent. Well done. Here's a comment from Jean Marie Oakman, which says in-person teachers are also using the VTVLC curriculum, but they can also import Eureka and Foundations, for example, if they so choose. This will help if kids and teachers go out ill, or if we all have to go remote. Thank you for all you do, Larry. Thank you for all you do, Angie.
Yes, thank you. Scott, you had a question?
Thank you, Amy. Thank you, Amy. Thank you, Elizabeth. Yeah, so this is something that came from a Heartland board meeting just a few days ago. So I think we're bringing it up again. Can someone please explain what the student experience will be using this Canvas platform, and specifically in regards to the facilitators and then the teachers of the embedded instruction? So can a student expect their teacher that they know to be leading the embedded instruction, but perhaps is that expectation not going to hold true for the facilitator?
No, I think, and Angie, again, you can fill in the blanks here, but I think that's a great question. I think from a student standpoint, they're going to have contact with the supervisory union teacher. Now, remember, because we're going to go supervisory union wide with this, a Weathersfield teacher might have Windsor students, Albert Bridge students. We've talked about that before, right? So they'll have a class load. So it may not be a teacher / facilitator that they know and that they've seen before, but there'll be a lot of, introductory activities at the beginning, just like we would do with any kickoff of a new program. But the other part of your question, the student day, I think every day there'll be contact with that teacher / facilitator. It might be set up unlike last year, last spring, where you might have your whole class in front of you, because it might be a multi-age group. The first graders may see their teacher from 9 to 10, and then the second grade from 10 to 11, and then there'd be support in the afternoon. But they would have regular contact and assignments with both the teacher facilitator and the embedded video instructors that are built into the curriculum. I don't know if that helps, Scott, and Angie, I don't know if you wanted to add to that, but that's my understanding of how it would work.
I think one of the best ways to see what it's like is to go to VTVLC, and I'll put that in the chat, to go. If you search that in Google, it brings up what their to-go curriculum is, and it has sample lessons. And a lot of it is, at first look, you might think, oh my goodness, if this is a third grade lesson, my student has to read this whole thing. My student's not a strong reader. How are they going to know how to do this? There are, what do you call them? Universally designed for learning accommodations or supports in the LMS that would read text aloud to students, for example. So if your 8-year-old or 10-year-old is sitting there and trying to complete their lesson, and the family member that supports that learning is busy with something else, that student should be able to have that lesson read to them so that they could then proceed. For the families that take this option, there will be a training for those families and those students so that they will be set up to be successful. We want all our students to be successful in this, and it's going to require making the right match of supports that the family needs to support the student in doing this often independent learning, not completely independent, and making sure that communication is strong. So we really want to set our families up for success, and go to that website and get us, again, if you're interested in that, and take a look at what the lessons may look like.
I appreciate that, Angie. Thank you. Thank you, David.
Yeah.
Nikki Buck has her hand virtually raised.
I think maybe we should answer Tina's question more directly because I suspect there are more people that have that question, and then I'll come back.
Yeah.
Okay. Tina's question is, am I understanding correctly, in-person learning for student will be with their regular teacher, but that teacher will be facilitating the VTVLC?
You got that,
Yeah.
Andrew?
The VTVLC the remote only teachers are not the classroom teachers from the building unless they have applied to be a remote only teacher. So
I think
He's saying in person.
Tina's question is about the in-person teachers, right? The teachers who are assigned in person that are in the buildings. And Tina, yes, you're right. They'll be using the Canvas platform and the VTVLC embedded curriculum. And I would hope both the remote teachers and the in-person teachers would also be able to do, some enhancement work. Like we've gotten some early feedback that in the VTVLC curriculum, there may not be enough phonetic work, enough phonics work. And we've got a wonderful program called Foundations. So we would expect that teachers might be wrapping in some of that Foundations work. But the platform, we want a consistent platform so that when we all move to remote, if we all move to remote, we've got a consistent platform in the SU.
Tina, I hope your question was answered adequately, because it looks like there are quite a few different answers in the chat box.
Thank you, Angie, for providing the link.
Nikki, do you want to ask your question now?
I didn't have a question so much as a comment, because I'm realizing that there are 76 people in this meeting, and a lot of those people haven't been involved in the Portrait of a Graduate work, which was kind of unveiled last night at our final meeting. And I will admit, and I'm also the optimist and always sees a ray of light, but I'm actually excited about this kind of crazy opportunity that we're switching curriculums in the middle of a pandemic. What's exciting to me is that this is, if we do make this curriculum switch, it's forcing us to move towards more project-based learning, which is the direction that we as a Portrait team, as a board, are also trying to move. And so it kind of feels like it's a jump start and a bit of a unique opportunity to change things up during a time that everything is chaotic and changing anyway. And so I personally am excited about this opportunity. And I'm also hopeful that by using the VTVLC program, it will be easier on teachers when we go full remote. And I'll also comment that, David, I love the fact that you are talking about going full remote and then having a vaccine and being all in school. So all in the same comment. So thank you.
That's how my head's working lately.
Angie, can you comment on the amount of screen time involved with the VTVLC?
The guidelines on the VTVLC site say 3 to 4 hours for a course, and the elementary curriculum is considered a course. So 3 to 4 hours a week So I'm thinking that's direct interaction with the program. There also will be, you know, other assignments, and of course that's only limited by the teacher and the child's imagination. So I think one of the things we were mindful of is how much screen time. We heard that loud and clear from our parents, that especially for our younger students, that the amount of screen time required needed to be carefully thought out.
Thank you, Elizabeth, for keeping up with the chat and giving people a chance to have answers to their questions. And what was the last name? Mr.
Newsome, I think it was.
Mr. Baum had asked about teachers. At this point in time, if teachers would like to make a comment, if you could put your name in the chat, and then we will allow you to give up to 2 minutes to state kind of what you're thinking and how you're feeling at this point in time, so the parents as well as board members can have an idea of what kind of the environment is at the school. So any teachers who would like to?
Keegan, go ahead.
Keegan Eaker.
Thank you. I'm middle school social studies teacher at Windsor School, and I'm afraid. I love my job. I love my students. I love being a part of this community. And I have to have a whole lot of faith that the leadership team and the reopening task force are recognizing the degrees of safety that need to be in place for us to return. I understand that school provides a lot of important aspects that a child needs, from adequate medical care, having a safe place to be during the day, having adult supervision, access to nutritional food, along with our learning opportunities. But I'm scared. I have a husband that I live with my husband, and he has a compromised immune system. He has an autoimmune disorder that would make him at higher risk. He also has asthma. I have hypertension. And because the ADA accommodations only apply to me, and having met with my doctor and him saying that my personal conditions are not severe enough, I don't qualify for an ADA waiver. So I'm going to be commuting from my home in Jamaica through 7 different towns, coming to Windsor to do my job, and in constant fear that I could bring home to my family a horrible disease that we don't have a vaccine for, and that we're still learning more and more about. Now, I'm scared, and given the chance to stay home where it's safe, I would prefer that. But I know that my kids would benefit from my presence being in the school. I'm just incredibly afraid. So that's how I feel.
Thank you, Keegan.
Ann Steebing.
I'm concerned about mask off time, such as when the students are going to be eating breakfast or lunch in their classrooms. That seems to be a risk to me, and I'm not sure exactly how that would be navigated. Also, with teachers rotating from room to room, I feel like that potentially exposes those teachers to the virus in the different rooms, and could therefore be transmitting it from room to room. So I think those are my 2 main concerns, is the mask off time and teachers rotating from room to room.
And I saw in the box, Elizabeth, we have a couple of our school nurses on the line, because those last two comments, very heartfelt comments and concerning. They're sort of a little bit, I understand the emotional side of it, but a little bit on the medical side. But I saw that at least Elizabeth Martins would be glad to speak to both of those as one of the school nurses. We've involved the school nurses pretty heavily. They're all on our task force, and they've been faithful to coming to those meetings.
Elizabeth Martins, if you would like to comment, please, that would be great.
Okay. Can everyone hear me okay? I don't always have the best connection. Anyway, so yes. I have been part of the task. So I'm the Windsor school nurse. I've been part of the reopening task force, and I absolutely hear how Keegan feels. And I, certainly we have to all be vigilant. I also just want to say, from my perspective, we have a great plan. We have good administrators that have been on top of this careful planning that we've been doing. We do have a great plan with the masks, face shields for teachers. During the summer, I also work at the VA hospital, and I would say that our plan is 10 times safer than what we've been living at with the VA hospital, because our patients don't wear masks in their own inpatient rooms. And, we just have a face mask on. We wear face shields as well. But, to the point of eating and stuff like that, if you as the teacher are wearing a face mask and a shield while supervising a class that does not have masks on, all those students are going to be 6 feet apart, which puts them already in a very low risk category. And then you're going to be in extremely low risk category by also being with a face shield and a face mask. I think we do have to be very vigilant as far as local community spread that may or may not happen. But I think with the careful planning we've been doing, and the continued just watching over, I think that we have the very safest plan we possibly can for our students, our families, our faculty, and I know that all the school nurses are kind of feeling the same way, that we're apprehensive, but also feeling hopeful that we can provide the safest possible environment. So I think that was kind of it from my perspective, unless anyone had any questions for me.
Well, thank you very much, Elizabeth. I'm sorry, Amy.
Oh, it's okay. So
Co-chairs, I like that.
There are 2 questions. Zachary Chambeau is asking, is there a possibility of layoffs if we were to go remote?
Yeah, what we found in the spring when we went to completely remote, there may be a little less of this with the VTVLC kind of built-in curriculum, but it seemed like there was even more of a need for that type of support. So I think we certainly would not be reducing the professional teaching staff at all, and it would be our plan at this point not to reduce the support staff either, because those are the ones who are supporting those kids, checking in with those kids, and that worked last spring. And I think we would, of course, we would listen to advice of the board, and we would come back to the board and sort of show you how we've distributed personnel. But at this time, there'd be no plan to lay anybody off.
Kirsten McNamara would like to speak.
Hi, can you hear me?
Yeah.
So I'm a 2nd grade teacher over at the Weathersfield School, and like Keegan, have some underlying conditions, and I'm extremely worried about returning, not only for my own safety, but also for the safety of the kids. I just, especially with the younger ones, I'm concerned with children understanding and being able to keep those masks on, to keep that social distancing indoors and outdoors. I'm being around kids for over 2 decades now. I'm very concerned about the children being able to deal with this.
Thank you, Kirsten.
Thank you.
Amy, I just want to ask, make sure that Anne got her her concern addressed. And Steebing, did you get your concern addressed?
I feel like it's a schedule specific concern, and so I feel like it's going to be more addressed within the school.
Okay.
So
Just checking.
Thank you, Anne. Are there any other teachers who would like to comment? Hearing none, seeing none in the chat, I will turn it to, Heather Pogue.
Hi. First, I just want to say thank you to the administration and the SU board. I know you guys have been working absolutely tirelessly all summer to come up with this plan. And I think there are no good or easy decisions to be made around this. And I recognize that. I think that Heartland and the SU has a good plan. And I'm still having extreme anxiety about going back to school. Part of that is because both my husband and I were sick in March with what I believe was COVID, but it was too early because there was no testing at that point. And I was literally sick for 3 months. I could not have come to school if we were in school. And the only way that I could continue my job is because we were remote. I could not worry about infecting other people. I could take a nap when I had to take a nap, and I didn't have to worry about my family getting sick or sicker. And I mean, I won't go into details, but it was terrifying. And I'm concerned about within the classroom, I'm concerned about behavior management. All of the systems that we've put in place over the last 10 years, I'm not really sure how those we can apply when they're supposed to sit in a desk and not move around the room, and we can't send them out of the room and no one else can come into the room. I'm concerned about exposure beyond our, room pods and schools. As much as we like to think that we're not connected, we're connected across towns and communities. Just within my family group, I have 2 other teachers at 2 different schools who have children at 2 different schools with whom, we're interacting with. So that just within, my immediate family group, there's going to be a ton of exposure across the Upper Valley. So I'm concerned about that. I'm also concerned about exposure to aerosolized chemicals as misted disinfectants in the room, having to spend, time. I realize we can go outside and we're extremely lucky to have the 17-acre woods, and I will certainly make as much use of outside time as possible, but that's a major concern for me as well. Thank you.
Thank you, Heather. Catherine Engwell.
Hi, I am a high school teacher as well as the union president. So I just wanted to share kind of the thoughts that we have been expressing. And I agree with everything they just said. I hope you get access to the comments because I encourage our membership to speak their mind about how they're feeling. And when Angie said we're at a 2, I feel that really is how we feel. Some are calling and they,
I think we're breaking up a little, Catherine.
Yeah,
am I
your
breaking up?
connection is a
Maybe I
little.
should
Yeah.
go inside. I
Yeah,
have
you
a,
might want to get closer to your Wi-Fi access
Okay.
point.
sorry about that. You're gonna watch me walk through my house, so give me a second.
Actually, it's better now.
Well, okay, I'll just stand here. Some people feel more comfortable and other people are really, really concerned. When we kind of think through our day, a question comes up. And then when you ask that question, then another question comes up. Like, what if it's too hot in our room and we can't have an air conditioning unit? So then we go outside. Okay, are they going to have sunscreen? What if somebody gets stung by a bee? What if there isn't a place to go to the bathroom? I mean, it's just that every time you try to think through one question, it leads you to a series of other questions. And we don't feel that we have really solid answers. And what I appreciate about this group that we've been working with all summer is they say we don't have all the answers. And I really honestly appreciate that. But as the school year draws closer and closer, we get to this point where it's like, okay, now we really need these answers. And we don't feel like we have them. And it's not anybody's fault. It's just we're in an unusual circumstance. So I guess there's going to be a not handout, but a pamphlet or something that's going to answer a bunch of the questions. But we're just, we got a lot of them and we're not quite there yet. So I don't know if that covers it all, but we're excited to see the kids. We want to see them, but we don't know how to do it safely.
Yeah, and I appreciate that, Catherine. And Catherine's been an integral part of of some of the planning here, and I know that is again truly heartfelt in what you're saying. But I think you really hit on a key point there, right? That yeah, we'll issue frequently asked questions, we'll answer questions, but Catherine very eloquently said, every time you answer questions, 3 more questions follow. Will we be able to answer all the questions? And I think that's where the administrative team wants to be completely transparent and honest. No, we will not be able to answer all the questions. It'll be happening in the moment. We'll respond diligently. I think we've got great medical personnel in our buildings. We will be cautious, both in terms of presumptive cases or identified cases. And I know, certainly as the superintendent, I think I can speak for the whole supervisory union board and the task force that if and when we have to close, we will close and we won't think twice about it. I mean, that's the bottom line. And I understand that people say, well, will that be too late? Or, I don't know all the time exactly what. All I know is we have a commitment to keeping students and staff safe. And if on day 1, this doesn't look doable, we do not open on day 2. That's the bottom line. And I just want to assure everybody of that. And we will be taking no pun intended, but we'll be taking the temperature that Tuesday afternoon. And even if we have to stay an hour, a couple hours after, we're out at 12:30, if we have to spend the whole afternoon debriefing and we feel we can't manage this, we will not open on Tuesday. That's the bottom line.
Thank you.
David, I've got a quick question. This is Elizabeth. So am I to understand that all of the schools, it's either all of the schools open or all of the schools close? Is that right?
Yes, that's and again, I know we've talked about this, but that is my understanding, which is why we've had these countless conversations at the supervisory union level, because of the way we have worked so well together and how our employees are so interwoven that you couldn't have one school go all remote and another school
That's not what I mean. That's not what I mean. Actually, what I meant was in terms of not on the first day, but
I get you. Right.
Further down the road. Is that an individual school decision or building decision, or is that an SU-wide decision?
No, that would be only because the state has authorized, those decisions to be made at the superintendent level. So it would be but it could be building by building, right? I mean, if we had to contain a building and we felt that there was a too high a risk in a building, we could temporarily close down just a building. And a matter of fact, we will be depending strongly, because I saw one of the questions in the chat box was what happens if either a student tests positive or a staff member tests positive or even is presumptive positive. And the nurses are working with the Vermont Department of Health to come up with a protocol. They know all the questions to answer and ask. First of all, if they're experiencing symptoms, they won't be allowed in the building at the health check station. But if they're in the building and then they start to exhibit symptoms, we have isolation spots where they'll be out of the HVAC system that would be carrying any virus around the building. But then the nurses take over from there with the Vermont Department of Health. But if one building should decide that they have a concern and they need to close, that decision can be made. We would, of course, be in constant contact with the contact tracers, the Vermont Department of Health. They have incredible protocols, and our nurses are going to be very well schooled in those protocols. And they would tell us that, yeah, these people need to quarantine. These people need to be tested or not. But one of the things that we'll do, though, because I think Keegan expressed it well, there's the science and then there's the anxiety. And we learned that this summer with the summer food program, when we had somebody test positive in the summer food program. The Vermont Department of Health and the contact tracers said to us, nobody needs to be tested. Everybody can stay at work. When we looked at the anxiety on the faces of those employees, we realized we didn't care what the Vermont Department of Health said. We could not continue until we had time to sort this out, do a deep clean, get everybody to take a breath. And that's exactly what we'll do. We will listen to our employees. We will listen to our parents and families. And we will also listen to the Vermont Department of Health. But our parents and families and our staff will trump the Department of Health, because we can't have teachers who are overly anxious and fearful because we don't feel we need to contact trace. So, but the simple answer to the question, Elizabeth, is yes, it could be done by building. It could be done by pod. It could be done by classroom or wing. So I think that that's important to note, and we would keep everybody involved, completely posted at that point. We have a pretty good communications plan. It's going to get better once we get the final, and I don't know, the nurses are on the line, that we're waiting for a final report from the Vermont Department of Health. I don't know if that's in yet, but then we'll be putting together those written protocols.
There are a couple of really good comments in the comment box over here about one's from Amanda French saying, I think in general people are scared and this is a risk. It's been said we will know if we didn't do enough at the cost of lives. Jennifer Aldrich says, I would like to encourage those with clear concerns to share those concerns. It's very challenging to develop comprehensive solutions that lack full understanding of the problems at hand. And as an admin team, we appreciate that this requires vulnerability and courage. Let's see. Are there any people who... Melissa Fox, would you like to?
Yeah, I just have a quick comment. I just want to make sure that we don't stop our planning once we get back into school. Say things do go great the first week, awesome, but let's not just pat ourselves on the back and stop planning, because the weather's going to change. One of our biggest mitigations is, hey, we're going to go outside. But that's not going to be feasible in January when half our kids are showing up in sneakers and sweatshirts. So we need to continue planning to keep ourselves in school. That's all I had.
I think that's a great point, Melissa. And it's my plan to keep the reopening task force. I haven't told them this yet, but keep that reopening task force alive and well, even once we start.
Leanna Robinson, would you like to give a comment?
Hi, can you hear me okay?
Yes.
Okay. I'm a teacher, and I think I will side with many other colleagues of mine that I am also concerned about reopening schools. I think the plan in place is well thought out and detailed. I'm just concerned about implementing this plan too soon and what the consequences of those actions may be. I personally am a teacher whose doctor has recommended that I apply for ADA accommodations based on health issues of mine, and I don't plan to do so. I feel like I'm putting my health in the back seat for my job. I love my job, my students, my school, and I feel like I will do whatever I need to support them. I think that students and parents really think that opening schools is kind of returning to normalcy, and nothing feels normal about this. Schools and the classrooms will look drastically different. I think, Dr. Baker, you may have even compared it to like being kind of stark in some ways. The way we interact with students will change, as well as the way they interact with us. The play and the socialization that they're longing for is going to be difficult, and maybe even a thing of the past for a while. The more and more that I think about this new school environment, the less warmth that I feel from the school building, and the more clinical that it feels to me. I vehemently believe in the power of connections and relationships, and I live and I breathe that. And there is nothing more than I want to be back in the classroom with my students, but I worry. I am fearful. I'm fearful that, all it takes is one person, one person is all it really takes. And I worry about how good of a teacher I'm going to be when I'm constantly worried about protecting my students. That's really what it comes down to for me, is protecting them and their families, because I care so deeply about them, and protecting my colleagues. And I worry that I'll sacrifice my relationships and my connections for the safety protocols and for distance. Just the thought of, I'm a kindergarten teacher, and just the thought of a student running towards me, expecting an embrace, only to be turned away for their safety and my own, absolutely guts me. It devastates me to my core. And I think that we talk a lot about mental health and the isolation that comes from remote learning, and I agree. It can have terrible effects on children. But I think we should also ask ourselves, are we prepared to respond to the trauma that our community would face if, God forbid, someone, student, teacher, family, dies because we opened too soon? I worry that just trying it out and seeing how it goes with the lives of teachers, children, and families at stake is really not a risk that I think we should be taking. It's not a roll of the dice that I think we should take. So thank you.
Thank you, Leanna. Mark has a question. Are we doing anything as an SU to directly link staff and students with testing? And would that even be possible?
Yeah, I don't know if one of the nurses want to take that question, but it's my understanding that we are going to have a unique bond with both the Vermont Department of Health and this may be true with all school districts and supervisory unions. We happen to have the advantage of a great regional hospital right in our midst, Mount Ascutney, and so we will have that direct access. Again, if there's a nurse on the line that wants to talk about how that would work and how one goes about ensuring that those tests are both viable and accessible, that's fine. But that's my understanding. We're going to have a hotline directly to these medical professionals. Emily Stevens said she can talk about that. She's one of the nurses. She's a nurse at Weathersfield.
and here I am. He was asymptomatic.
Yeah, but you're good.
Oh, we got.
Can you hear me, David? Yeah, can you hear me?
Yes, we got you. Yeah.
Okay, so we have what we refer to as the BAT phone at Vermont Department of Health. So that's public health nurses that are just for school nurses that we can call with any questions. We're working closely with Mount Ascutney Hospital for testing. We have revised health and safety guidelines from the Vermont Department of Health that were released on the 11th. What's not completed yet is an algorithm for symptoms. So there's different levels depending on the symptoms we see in the school. Some might be go home until you're free of the symptom you have for 24 hours. Level 2 is we have to call your PCP. You can't return to cleared. Level 3 is you can't come in the building. So that's not finished yet, but that will really guide us in who we call. But we have an amazing relationship with Mount Ascutney Hospital. Their pediatricians, their microbiologists have all been working with us on the safety plan and how to safely reopen schools for the students and the staff. And I think we're very lucky with the supports that we have currently.
Yeah. Thanks, Emily. And I would assume that algorithm will certainly be done before there's any attempt to go back to school, correct?
So my understanding is it's very close. They send it out to pediatrician's office around the state and look for feedback. And then once they get that feedback, they complete it and then we'll release it. And I would hope we have it maybe the end of this week, but definitely next week.
Yeah. And that's an example to everybody on this call. If we didn't have that algorithm, we don't open. It's as simple as that. So, those are the kind of things that are medically technical, incredibly sensitive. And I want to, again, give a shout out to Elizabeth and Emily and Annette and Jean. We have amazing school nurses, and they have been connected to the Vermont Department of Health since they left school in June. And they're having regular meetings. Some of that's facilitated by Otella Perry, who's been outstanding contact at Mount Ascutney Hospital. So I'll tell you, we are so fortunate to be living and working and recreating in the Upper Valley, especially this supervisory union, because the community support is absolutely unbelievable. I do not see it. I just want to say, I say that comparing, I'm in the Northeast Kingdom. Nothing like this is happening in the Northeast Kingdom. So I just want you to know how fortunate we are.
Before you start, Larry, Melissa Fox has a question. Can asymptomatic teachers and staff get a test for peace of mind before we head back into the building?
Yeah, hold on. Somebody wants to get in. Right, Scott Pula, one of our teachers at Windsor. We have certainly explored that. We are not opposed to that. Right now, all the medical professionals, and again, maybe somebody on the line like Emily or Annette or Elizabeth might want to respond to that. I guess it would be just for peace of mind, because we've been told there is literally no value to that. But would somebody with a medical background want to explain that better, to do some sort of universal testing?
So I can help with that too, David. What we discussed with the pediatricians and the Department of Health people is you can for peace of mind, but that only gives you a snapshot in time. So you might test negative or positive right then. And then say you go to the grocery store that night, or you go to a barbecue, you could easily pick it up that evening and then be positive like the following Monday or Tuesday. So yes, it might give you peace of mind for that day, but the next day could be very different. So that's why it's not recommended. If that makes sense.
I think the way to compare this would be if you look at, they're having tremendous success with the NBA that's living in a bubble. They're not going anywhere. They quarantine for 14 days. They're playing all their games within this bubble, and even that hasn't been 100%. But they did test everybody before they came. The problem is, as we go back to school, we're not going to be living in a bubble. And what Emily said is we're going to be doing family events. We're going to be traveling. We're going to be grocery shopping. Now, what we have in our favor, and again, I know it's not comforting to everybody, the transmission rate right now in Vermont is negligible. It's 0.07. I think it's under 1%. So but does that mean that some of us on this hangout tonight are asymptomatic and aren't carrying that COVID virus? Probably there are a couple of us on here. I mean, but I think that's just going to be the general reality. I don't like it, but 0.5% is what I'm told, right? Okay. Sorry, 0.5%. Less than 1%, though. Did Larry have a question?
Yeah, Larry had a comment or question.
Yeah, I'll just give my thoughts. I shared it with the union last Friday in the meeting with the admin team. I think the least equitable thing we can do for the kids, and I know we talk a lot about equity at board meetings. We talk a lot about it at the admin council. We talk a lot about it. I know the union cares a lot about equity. I know teachers care about equity. Is to go remote, 100% remote. That's the least equitable thing, because it's not fair to Cadence that she has a dad who can help her with math when she has a math question. And it's not fair that Angela is a kindergarten teacher and she can help Bradley with his speech. And I think we have to realize that there's a lot of families out there that aren't as lucky as my family is. So I really worry about that. That being said, I am also worried about, people I know and worked with for 20 years and love getting sick. I don't want anybody to get sick. And I have a lot of best friends who I grew up with. Mike Walker works in Weathersfield. He works for me. My brother works in the building. My wife works in the building. I have kids who go in the building. Friends of mine who coach for the sports are around in the building. So I just, it really worries me. And to show how crazy this disease is and what people don't know about it is, I was going to last Friday, right after I said this to the union, I had to go get tested because I was going to go work a basketball camp in Pennsylvania. That was a bubble format like the NBA. And they required all the coaches to get tested. And I got tested. I felt great. I feel great now. I tested positive last Friday. I've been isolated since then. I haven't left the house. I feel great. I don't have any symptoms. My wife tested negative yesterday. She's been with me since last Wednesday, which is when they feel infectious. I thought it was a false positive. I said, is it possible it's a false positive? And they said with the type of test I took, which is a PCR test, it was very unlikely to be a false positive. If anything, it would have been a false negative. And again, I was so shocked because now I felt bad for Cadence because she couldn't go to the basketball camp with me. But they said 40% of the people that they can find right now are asymptomatic. 40% is a big number. 40% of 100 is 40 people are walking around and don't know that they're carrying it. I didn't know I was carrying it. I had no symptoms. Most people don't get tested until they have symptoms, right? So I feel really conflicted about it. Personally, I think it would be awful for many of our kids to be remote. I don't think it's the best thing for the kids. I think that's why the Vermont Academy of Pediatrics said that. And I also think at the same time, I don't want to see anybody get sick. And so I feel conflicted. I appreciate the teacher speaking out. And I think maybe if people knew that somebody like me who just got tested on a fluke, on a lark, could test positive, that it's definitely out there. And I wear my mask. You guys know me. I'm walking around the building with my mask on. I wear my mask everywhere. I go to the grocery store with a mask on. Angela and the kids, they haven't left the house much, but when they do, they wear their mask. So it's just one of those things that I'm happy that 40% are asymptomatic because that means 40% are not going to be sick. But the 60%, have mild symptoms and then some get really sick. So take that for what it is. And those are my thoughts. I don't have a good answer. There is no good answer. Thank you.
Larry, first of all, I want to thank you for your courage to share. You didn't have to do that. Your medical issues over the last, and that testing. I know we've had a lot of phone conversations and text messaging back and forth, and I appreciate your honesty tonight. But I think that's a great example of just where we sit. I do, as a math teacher, I want to, and I know this isn't what Larry said, but I want to make sure we correct the math here. Larry did not say that 40 out of 100 asymptomatic people will be COVID positive. What he's saying is, of the COVID positive people, 40% are asymptomatic. So we probably have almost 100 people on this call, and I just didn't want 40 of you to run out and get a test tomorrow, because that's not what Larry said. But again, thanks for the courage, Larry. And I think it's an example of what we face. And by the way, I think I can share this. Friday morning, the administrators we had an in-person retreat, and Larry was at that retreat. So you can imagine how the administrative team has been, dealing with this over the last 5 or 6 days. But we've, in some ways it's good, because it's a lived reality of what we're going to be asking our kids, our families, our staff to do. And we did what we were supposed to do. The contact traces that Larry spoke to did what they were supposed to do. And some of us, because of vulnerabilities, decided to be tested. Some decided not to. So it's just what we're living with.
And I think the other thing too is the VDH. They called me immediately. They've been sending me text messages. They're following up with me every day, making sure I'm still asymptomatic. And so Vermont's been great about that. And the other thing I would say is, when I told them about our meeting and how we were in a large room, separated 6 feet. When we got near 6 feet, we had masks on. They said that you guys didn't need to quarantine. It was only the people who I had been in contact with since last Wednesday without a mask indoors within 6 feet, which pretty much my immediate family.
Larry, I'd like to reiterate, because I'm over 65 and have health conditions. When Larry was very transparent with the team, I immediately called the Vermont Department of Health, and we had an extensive conversation. My question was, do I quarantine and do I get the test? And they asked me a lot of questions about, were we wearing masks? Were we 6 feet apart? Did we come in contact? And the answer to me was, you do not need to quarantine and you do not need to test. I did follow that up with my doctor, who said the same thing. So that's an example. And I don't want to minimize or dismiss any of these very real feelings that have been expressed, but I think the science is there. And if I sat closest to Larry Dower, who tested positive, and I did what I needed to do to find out next steps. And when the Vermont Department of Health is saying, you don't have to quarantine and you don't have to be tested, I think that says something. So when we're in a school setting, that might be true as well. The key will be in social distancing and wearing our masks.
And that's why I want to make sure that everybody in this hangout, and I realize the board's going to make the final decision about how we open and when we open, because the governor and the Secretary of Education gave that authority to the board. That's why we're here tonight. But that's why, if on day one we can't keep masks on kids, we can't keep socially distanced, we have problems like that, we will not open on Tuesday. Matter of fact, we may not even finish the day on Wednesday. On Tuesday, I just want everybody to be assured we are not going to take any chances. We are going to continually evaluate whether or not we can keep the environment safe. And if we can't, we will not go to school. That's my strong commitment. And again, the board will have the final decision about how we open. But I just want you to know that that's how your superintendent feels. It just, you all, the kids mean too much to me. You all mean too much to me. We're not going to take any chances.
Beth Ziegler. Thank you, David. Beth Ziegler, you had a comment?
Yes. Can you hear me okay?
Yes.
Okay, great. I wanted to tell Larry how much I appreciated his honesty, and it let me start thinking about, well, I've already been thinking about what, we as teachers are willingly in this profession, and we do it because we love it. We are connected, obviously, to many people who are not teachers and didn't choose this risk. So that's my first question. How do we how do we ask this of our families? Do we go live in a bubble, which obviously we can't do, but this is what's swirling in my mind right now. And my second question was, how quickly can we get the information in our school or in our SU about number of cases? I get, confidentiality remains obviously, but that there is a case, how quickly can all of this be communicated, obviously. So my first was just a comment, a concern, and the second was a question. Thank you.
Yeah. No, I think they are both, excellent questions, Beth. In terms of, and again, I hate to keep doing this, but Elizabeth Martins and Emily and Annette, if you're on the line, are nurses, particularly Elizabeth, because you've been in this environment. You have a family. What does that mean for people who are going home to vulnerable parents? To how does that work? Does anybody from a medical perspective want to answer that question? Maybe we lost Elizabeth. Did we lose Elizabeth or Emily?
I'm still here, David. Can you just repeat it one more time, what you want me to answer?
Yeah. Were you putting the kids to bed, Emily? No, Emily.
No, they're running through the room, actually. That's why I'm muted.
No, that's okay. I know you got the full Monty there, but yeah. So the comment, which I think is really a question, right? That we are essential workers. We know what we have to do. When our board tells us, so when the agency that licensed us tells us, but our family members. I mean, I have a compromised, wife, and many of you live with, children or significant others or elderly parents who are particularly compromised and will be in this environment all day, masked and distanced, and then going home to these people. I know hospitals have done this for a long time, right? I know when we first started, we knew nothing about the virus. Nurses and doctors, some of them were living in hotels because they didn't want to be near their families. But now that we know about the virus, is there anything, we could say to a teacher or a paraprofessional or an administrator that would be, comforting about the science of bringing something home to them from a school environment?
Yeah, so the safety guidelines are what's helping a lot. So the 6 feet of social distancing, the wearing the masks, the washing your hands, like we can't reinforce that, over and over again. That's what we're telling people. When I come home from the hospital, because I've been working shifts at the hospital, the first thing I do is put my clothes in the washing machine and go take a shower and wash and everything like that to protect my family, just in case there is something on me. But if there is a positive, if we send someone up for a test, some tests are coming back in 8 to 12 hours, depending what they're getting, some in 24. Vermont Department of Health updates those numbers daily. So that they are the first ones to find out if there's a positive test immediately. And then they begin the contact tracing. So they'll want to know who was in that student's classroom or who was in that teacher's classroom and what kids were sitting next to them. And that's what they start immediately making phone calls and telling you what to do. So I know lots of people that have tested positive and then they quarantined in their own house. So they stayed in one bedroom or they stayed in the, downstairs. And they just did safety precautions within their own home and nobody else in the home got sick. So like I said, lots of hand washing, wear your mask, like I said, put my stuff in the laundry room, right in the washing machine when I get home. Stuff like that is the best way to stay safe.
Yeah. Thanks, Emily. I think you answered part of Beth's other question, that the Vermont Department of Health updates that transmission threshold, by county daily. I think it only gets published maybe once a week, but we'll have access to it on a very regular, on a daily basis.
Yeah, I get the numbers daily, David.
Yeah, our nurses will. Thank you.
Are there other teachers or staff who would like to make more comments? If not, let's go to board members. So we are now on board members. You're welcome, Keegan. Thank you. Thank you to all of the teachers, staff who spoke and let us know how you're thinking and feeling. These are really, really hard decisions, taking everyone's concerns. We have parent concerns on both sides. We have administration concerns, and we have teacher concerns. This is probably the hardest decision as a board that we'll have possibly ever made. But I will take board member comments now. Colleen.
Hi. I want to thank all of the teachers too for commenting. It really helps to hear what people are thinking and the concerns that you have. And I think, I can't speak for the whole board, but to a point, I think these are concerns that we have too in the decision-making process. Certainly I have. And a couple of the biggest things that stood up for me in the beginning of this process, like as I was kind of learning what the plan was going to be, has been mentioned tonight, our kids going to be able to wear masks? Our little kids going to keep the masks on? And I've had reports from a couple of people who were involved with summer camps or preschool over the summer that reported that the kids were really great about wearing masks, that it wasn't, she had expected, or people had expected, that kids would have a hard time wearing masks, and it turned out that wasn't really true for them, which made me feel a little better. I don't know if it's going to be true for our kids, but having heard that made me feel a little bit better. The other thing that I worried about was what we would do, what the response would be if we had somebody show up at school and get symptomatic through your day. And knowing that our response is to call the Vermont Department of Health and have them walk us through what we need to do next gives me some comfort, because I feel like our state is doing the best job of contact tracing and giving advice to people that any state is doing. The last thing that has come up for me tonight is, I've had so much anxiety around this time too. I have kids that are going into school where, making the same parental decisions that parents are making, and on top of making board decisions. My wife works at a hospital, and when when we all came home and she was going back to the hospital and we were at home, we had a lot of fear around her, coming and going. Like, do you need to get a hotel room? Or, we were all really worried. And I think just kind of seeing the process through which in her conversations about her staff, she's admin, she doesn't do direct care. She's not seeing people directly, which makes her a little more at risk because she's not in a face shield, and you can have indirect contact. Anyway, I guess just through time that anxiety went away some. But what I'm reminded of today is that level of anxiety that we had in our household when we knew that she was going to still have to go to work. Those are just my thoughts. I just want you to know that we hear you and we're with you. We're trying to make the best decisions we can.
Thank you, Colleen. Beth is up next.
Yeah, thanks, Colleen. So I think one of the things to echo a bit about what Colleen said around, right, so thank you, teachers, for your comments. I think the piece that, right, I heard, and I keep going back to this question every time we have a meeting, is I hear a lot about the little kids and the mask wearing and the concerns, right, and the ability to distance and stay away from each other and sit in the room and sit tidy, right, for 4 hours or right, whatever the time frame is that they're in the school. So I will, again, ask that we consider the high school students, 9 through 12, be treated differently as K through 8, because it sounds to me like, oh, I know there are some high school and middle school teachers, or sorry, some on the phone and middle school teachers that spoke, but I'm hearing more of the, right, kind of really big concern around the little kids. So I would also, right, kind of echo a little bit of what Colleen said around, right, what we heard, I think it was in one of these forums around the little kids wearing the mask around town. And I will say, right, in the Windsor Rec program, there have been 40 to 50 kids running around town for the last 3 months, I guess. I don't know, however long they've been doing it, right, enjoying their summer, which they should be able to do. So again, I understand, right, the rate is low and the kids are intermingling, but I'd ask that we seriously consider, right, if we're making a decision on total remote for K through whatever, it stays at that level and we get to vote separately on the high school for that very reason that a lot of people brought up. The other piece, right, from my perspective that I still struggle with a bit, I hear everybody, I understand perspectives here, but I'm not hearing this parent voice here, right, because I'm having a hard time reconciling 80% of the parents want their kids to go back and 75% of the teachers don't want to go back or are concerned about going back. So for me, that's really a hard thing that I'm quite frankly having a hard time reconciling those two numbers because they are absolutely at odds with each other. So that's one piece. So I don't know. I know we talked about, do we do a forum for parents at some point? I'm sure they could join if they probably thought that they knew it was on tonight. I don't know. The other thing that I would say, right, the last piece around the science part or sort of the science part is, right, 20 countries as of June have reopened their schools around the world. So it's not as if we are doing this right out of the gate by ourselves in making this decision. So that's one thing that I would say is countries around the globe that have a much higher incident rate than this little area have opened their schools, all because, right, the kids, right, need to get back to school. It's a social thing. It's an emotional thing. I realize the health kind of concerns being raised. So that's my one comment on, right, the science side of it, right? It's not so much the science, but just the reality of it. And then also, right, schools in Massachusetts, right, where my kids came from, are opening their school and actually putting something in place that I thought was quite clever, which we did talk about at the Mount Scottney School District earlier this week. And how do we get them outside more? So in that particular school district, they're actually setting up tents outside for and it's far bigger classrooms than in Windsor. And that's what they're doing from September to November. That's their plan. So they keep them outside, socially distanced, masked, gives them an opportunity to be together, but outside. So that's kind of one of my last comments on this. And again, my big thing is, right, if we're gonna, right, be concerned, yes, around the little kids in terms of ability to control themselves, wear the mask in the system, I do ask that we reconsider having school district votes versus union votes.
Yeah, I think Beth, because you have been consistent with that request. Here's the problem, though, and I know we have some union folks on the phone, but we have a collective bargaining agreement that covers K-12 teachers, and the working conditions are right in that collective bargaining. And if you started to disassociate those conditions, you heard the anxiety, even with high school teachers, elementary teachers. I just don't think you could be disparate and separate out high school, they go in, and the elementary stays out. I think you would get a grievance on that within 1 second, because you'd have two sets of working conditions for teachers. And I respect your opinion, and you have been consistent in that opinion, but I'm just telling you from a labor perspective, I just don't see it.
And you're next. I just want to make a comment on something that Beth said. I was also, it was fascinating to see the numbers of parents desiring to send their kids back to school compared to the number of teachers who do not want that to happen. And how do we reconcile that? And how do we provide an equitable experience for all of our kids? And with that, I am going to mute myself and go to Anne. Anne Marie, we cannot hear you.
Just need to get that sound on, Ann. She's working on it. While Ann's working on her sound, I wanted to say one other thing to Beth, because I think that's, you know, that outside comment is.
Can you hear me now?
Yeah, Ann, now we got you. I'll make that comment later, but we agree with being outside is what I was telling Beth. Absolutely.
Can you hear me now?
Yes, we got you.
Okay, so I guess it was because I had my headphones plugged in, so everybody in the house didn't have to listen to this. That then mic wasn't working. I guess my comment I just want to make is that I hear all the teachers, and I feel I'm having a hard time with this because my family, we have someone in our household that we don't want to expose to the coronavirus, and I'm able to keep my kids home from school and to remote educate them. And I feel terrible if any teacher feels like they have to go to school because we're opening, even though they might have someone in their family that they don't want to expose. So I'm having a really hard time, reconciling that. And I would have a really hard time voting to go back to school, knowing that some teachers don't feel comfortable and they have to go back. If we could have some way where the teachers who don't feel comfortable could not go back, I would really prefer that.
Thank you, Anne Marie. Next on school board members. Nicole?
I also have a lot of anxiety about this. And initially, before this plan was in place, I was initially thinking about keeping my kids home. My kids have a lot of anxiety about going back to school. I think that there was a comment about how parents feel and if parents understand that things are not going to look normal. And I think, yes, every parent that I've talked to knows that things are not going to look normal. Every parent that I've talked to has a lot of anxiety about sending their kids back to school. A lot of parents would choose to keep their kids home, but that's just not, they recognize that their kids can't learn at home. And so the way that I'm looking at this, and I fully expect that we will be remote learning. And I think that we'll be remote learning sooner than, I feel like we're going to be remote again by October. And I'll be happy if we make it a little farther than that. What I want to do and what I feel is important is I feel like right now Vermont we are in a bubble. We have a really low positivity rate. The rates of our surrounding states are substantially higher than us. And if we can keep this low positivity rate into September, we have this kind of golden window of summer where we can be outside in nice weather and make a connection with our teachers, have the students connect, create classrooms, create that social environment so that we have, maybe it's even a 2-week window where we're outside in nice weather and engaging with each other, and then we're remote, but at least we've made those connections. We've taken advantage of the window. And yes, I do think we're going to be remote again. And I think that Vermont will go remote before the guidelines. I think the guidelines say you have to be 5%. I doubt that Vermont will continue to be in person if we even get up to 5%. And I suspect David Baker would not be in person if we get that high. And so I don't want to miss a window of being able to connect with our teachers, having an outdoor time, And I feel like that window is too important. And I don't think our kids are going to be able to learn if we just open up a computer screen and say, here's your teacher, here's your school. So I don't want to miss out on that.
Thank you, Nikki. Any other board member comments?
I'd like to respond to Nikki just for a minute, because you mentioned that at the last meeting, and I think it's a good suggestion, and we've been talking a lot about that as an administrative team, and that, you know, that first week at least, if we can do it well, would be a lot of outside, a lot of get to know you, a lot of activities that were just more social, emotional based, with the understanding that if, as I said so many times tonight, if it's not working, we're not going to do it. But at least we would have met our students, we would have interacted with our students, they would know us, we would know them, and we would have had some time to practice that LMS system, which teachers are going to do, I know, as soon as they get their password and their sign on, and we'd be ready to go remote if and when we had to go remote. But I think it was a good suggestion last time, Nikki, and I think it's a good suggestion now, if we do open that on the 8th, if the board decides that tonight.
Chris? And then you, Nancy. Chris Garnjos?
He's trying to find his volume as well.
There it is.
He's
I
got
am conflicted on this process. I appreciate what Nikki said. I also appreciate what Larry said about the whole concept of equity. My first reaction at this point is, if people are worried, we should just go all remote and deal with the consequences. I guess there is the part of me that says, yes, children will not learn as well for 6 months or a year. And those are certainly important 6 months or a year in every child's life, but it is only 6 months or a year of that child's life. Children are resilient and adapt to this stuff much better than adults do. So that's on one side of it. And then the other side of it is just that if we are doing a really good job, and I think we are, and of planning and preparing, there's a reason why our numbers in Vermont are low. And that's because we reacted quickly, and we planned, and we continued to put safeguards in place, and we continue to try to enforce them and speak up on them, and everybody's trying to work together rather than people worrying about their own personal stuff. So I guess I'm a positive person when it comes to these things. I think we can probably pull it off, but it is that line of where we're pulling it off. And what will happen is it still feels like a gamble, and whether or not it's a really good gamble or not, I'm not sure. And I really, like I said, really conflicted and torn about just how to answer this one. And I don't know that we're going to come up with what's difficult is that I think we could have this conversation 20 more times in the next 20 days.
Right.
And nothing that, unless there's a huge spike somewhere close by, nothing will have changed. If Vermont continues the way it is, we're still going to be at this same point, and people are still going to have their anxieties, and I certainly appreciate those anxieties. And I have a wife who's definitely with a weakened immune system, and I'm in that age range where I'm an old guy and I'm more vulnerable, but that's about all I could go on like this for a while, and it would leave me just the same place, and just the same place that I think that we're at. I don't know what we do. That's it.
Thank you, Chris. I know that's where I am too. Nancy.
Yes. I live in a multi-generational house. I'm the top of the, and
Pyramid.
my two grandkids, yes, pyramid. Both have been in the Windsor Rec summer camp since June, and they don't wear masks. They actually are not socially distanced, and there hasn't been a single case of anything. If that helps at all, of course, I can't say that the rest of the summer is going to be perfect and that school's going to be perfect, but it's one thing to think about, that not one child has been sent home sick with COVID. They did send a group home because they had colds, and they were all back within a day or two. Everyone's temperature is taken every day, so no one would ever even get in camp who didn't feel well. And that's part of the protocol for school. I certainly hear the teachers, but I work, and so I'm with the public, and one of my jobs is in a museum, so people are from other states, and I'm still safe. I must say, I don't worry, and I think that mindset is really good for me. So I would hope that our schools could open in person.
Thank you, Nancy. Elizabeth, would you be willing to read a couple of the items in the chat box? I think one of them might have something to do with the survey that Angie might be able to answer.
Yep. Hold on. Laurie Small, Angie, would like to know if surveys were similar for parents and teachers. Were parents asked if they preferred in-school instead of homeschool? Were there gauges of safety concerns and or how they felt about sending their children back to school, or was it more of a convenience preference?
The question, hi Laurie, the question was, would you send your child to in-person school? Yes or no? If they responded yes, they were asked subsequent questions about their risk tolerance. So for example, if the number of cases spiked in Windsor Southeast supervisory schools, supervisor union schools, or communities, would you send your child to school if the local schools in the area, Hartford, Springfield, Woodstock, etc., had an increase in cases? Or would you send your child to school if there was an increase in cases in the Windsor County? The one that did seem to concern parents the most actually was like 50-50 for Windsor County and surrounding schools. And there was definitely a clear, if there were a spike in cases locally at our local schools and our local towns, parents would choose not to send their children to school. More parents than not would choose to send their students to school. For the parents that said no, they would not be sending their child to in-person school, they were asked what their plan was. That plan, and they had two options. I will file a home study plan, or I have filed a home study plan with Vermont Agency of Education, or I would like to have a school approved remote option. Hope that helps.
It does somewhat,
But if they're preferring to send them to school, I'm not sure if it's going to make a difference if it's spiked or not. I don't think they have that same concern as the teachers.
Yeah, Lori, that's
Might be true.
yeah, that may be true because, I mean, they'll have to deal with the residuals when kids come home if there's
True.
a COVID spike. But the bottom line is they're not going to be there every day. Our teachers, and I see again tonight, it's a courageous bunch of people, and they've shared their anxieties. I didn't hear one of them, who spoke, say, if I've got to come back, I'm not going to come back. I mean, they love their kids and they'll do what this board asks them to do. But they are in a different place, Lori. You're absolutely right. They are in a different place than the parents who are answering a survey.
That's right.
They're going to be on the ground doing it every single day, which is why I said earlier, after that first day, we are going to pay very close attention. Remember, we dismiss at 12:30, and we've talked about leaving those first couple of afternoons pretty open. We're going to be talking to teachers about, is this working or isn't it? They're on the ground, and support staff.
Thank you, Dr. Baker. Angie.
Thank you, Lori. Thank you, David. Thank you, Angie. Next is Scott Richardson.
Hey, thank you, Amy. Thank you. So I'm going to echo or bounce off from Larry's start. He pointed out equity, and I think that's an awfully important spot to start. And I think that also that Nicole made a great point about the importance of our school district operations getting going, and so that what happens later can happen the best way possible. Get back to the equity piece. I don't believe we've heard tonight from our Director of Student Services. That is something that is a very significant piece of all of our in-school operations, and the populations of students that really need the school setting, perhaps more than other students do. And I wish we could hear about the importance of that tonight. Thank you.
Yeah, Katie is on the line. And
Yeah, Katie, would you like to speak to that?
not to get anybody worried, but Katie wasn't feeling that good today, but she looks better now.
I think one of the things that concerned us about remote learning had to do with the difficulty for many of our students accessing their classroom learning as well as their specialized learning remotely. And over time, much of that was solved through some very creative teaching, through some amazing feats of flexibility. With that said, we had some more success than I think we anticipated, but we also saw that there were many students that remote learning did not work for. They have their challenges cannot be mitigated and modified, accommodated, whatever word you'd like to use, through remote learning. So progress on IEP goals, progress in the general curriculum for many students has not happened. And it is a small group of students, but it's still a group of students that worries me greatly. I mean, that it truly does. We also have that. There's a statistic a family shared with me the other day, and I won't use the exact number, but it was because I have not vetted it, of the concern that children with developmental delays are at a much higher risk of contracting being ill just in general. And it's because they have comorbid disorders. And that's another concern. So of opening, I mean, there are pros and cons on both sides. And as I'm looking at this through the lens of an administrator who has to, whether we're remote or in person or hybrid, we still have to provide special education services. We're going to be doing a dual system for many students. whatever we decide here has ramifications. Nothing's a perfect fit for all students, but we're going to do the very, very best we can. And I don't know if that answers it there, because it's so much is uncertain, but it does weigh heavily on me for both, for all of the scenarios of how to make it work as best as we can, because we can't turn back the clock and have it go back to what September was. And judging, just like Dr. Baker had mentioned earlier, I'm on the phone once a week now with our regional SPED directors, as well as once a week with the state. We're meeting more than we ever had. And we're dealing with the same struggles everyone else is. I feel like we have a good support system, though, moving forward to have some creative solutions, whatever the board decides.
Thank you, Katie. I appreciate those comments.
Thank you, Scott, for your comments, and thank you, Katie, for addressing that as well. That gives us a lot of information. Are there any other board members who would like to speak?
Amy, while board members are thinking about weighing in, I did want to make a couple of announcements. First of all, there will be, because there is confusion about what in-person is going to look like. So there will be some parent forums in each of the districts coming up. Albert Bridge and West Windsor and Heartland are going to start early next week, and then we'll do Windsor, and because some of it is building specific and logistical, so we'll do them by community. And then there was one other thing I wanted to say, but it has escaped me. But I just wanted to make sure people knew that was going to happen. Oh, the frequently asked questions. Yeah, that Angie, among her other jobs, the whole administrative team, but we hope to get that printed really, really soon. But as Catherine Ingwall said, the answer to those frequently asked questions will raise 2 more questions per question. So it will always be a work in progress.
Right. It was kind of the same when we were setting up Tuesday for the election on how we were going to run the polls. And we learned as we went along just how we're going to have to run the general election. So it's all a work in progress. And Jennifer Aldrich had a comment. Jennifer, are you okay if I read your comment?
Absolutely.
She says, I'd like to share a few thoughts about equity in this. We struggle with equity even in person. Remote learning requires another adult at home, daycare, grandparents, etc. To be the expert in executive functioning, working memory, attention, social skills, cognitive flexibility, frustration tolerance, that's a big one, not to mention academics, math, ELA, PE, art, music, health, etc. There are significant inequities inherent in that and compounded by access to even being present while paying the bills. Well said, Jennifer. So there's so much to think about. And again, that gets back to what David and Catherine Engwall were saying, that for every concern, every question that gets answered, another one gets raised. And concern about in-person learning, concern about equity for distant learning, it's all it is so complicated. And Nicole, you have your hand raised.
Yeah, I want to echo some of what Chris Garnjos was saying, in that I think a lot of this conversation we can continue to have for the next month. And I am wondering how we move forward from here. We were all sent a Windsor Southeast Supervisory Union policy statement And David, I had a question for you. It's a policy statement, not a policy. Is that true? Is that different, or is it a policy?
Yeah, which one are you referring to, Nicole?
It's the modes of instruction during the state of emergency due to the pandemic.
Yeah, no, that's not an adopted policy. It's more of a protocol policy statement. Yeah,
it's a policy statement. So if
Correct.
we were to vote, do we have to vote on this, or?
Well, I think that was the, and that's very recent. I mean, that's why we're having this prolonged discussion, because that policy statement, was indicated that the local board, should vote specifically around the mode of operation. For example, will the supervisory union be 100% remote, or will we have a combination? So that, absent a vote, you can also authorize the superintendent, to make those decisions. But I think, given the severity of this and the voice that we've heard tonight, I think it would be good for us to all go on record, and whatever the decision, understanding that you would also be authorizing me, and I've already been authorized by the state board, that if we see the hint of any sort of a safety precaution right up until day one, we would not open. But I think we should have a board vote tonight.
So I'm just confused. Because there could be two potential board votes. There could be a board vote to support the plan as it is, with both the in-person option, or the hybrid in-person option, and the remote option.
Correct.
So we could vote on that, and
Correct.
then it'd be a separate vote, or should we combine all of that into one big old vote?
Nicole?
Yeah.
So looking at this mode of instruction during state of emergency due to COVID-19 pandemic, we have a first reading. So we would not be adopting that today.
Okay.
We could possibly adopt it at our regular meeting.
Yeah. I'm referring.
That's what I was intending.
Yeah, hold on.
Yeah.
So what I was going to ask our board, and that's why I was asking each of our board members to speak, is if someone would be willing to present a motion on having school with a hybrid model, as well as offering remote learning for those families who are requesting remote learning. And then someone would second that motion, and then I would do a roll call of SU board members.
So I'm willing to move the motion.
Looks like Colleen is seconding. Colleen Spence.
Second. Colleen seconds.
So it has been moved and seconded. Elizabeth Burrows is raising her hand, because now we get to comment on the motion.
I actually had a question about homeschooling. It's just a very brief question, and it's for Katie Ahern. Are students who are homeschooled entitled to special ed services?
No, not entitled. They may be offered special education services, but it's actually very clear on our paperwork and in the law that it is not an entitlement. And it says so in our rules. We, in normal times, try very hard to provide services and work with families who are homeschooling, who are official AOE homeschooling. This year, that is one of those questions we're trying to figure out how that could work in a very different environment. And we're trying to think as creatively as we can to still support students, but no, it is not an entitlement. And that is something that we have when families talk to us about what their options are. have done a lot of work with homeschooling families over the years. It was a major part of my job for several years, that we try to be as transparent as we can about what those choices mean.
Another comment, Elizabeth. I've talked to at least 3 homeschool parents who have been, because people have been homeschooling for a long time, who, because now we're offering a 100% remote option, are thinking about jumping off the AOE bandwagon and wanting to enroll in our schools for our 100% option. So I think that's sort of a new phenomenon. We haven't had that before. We've always tried to serve as best we could our homeschool students, and if they wanted to take band or art or music, we've tried to open our doors to that, and including support services. It's just that I think Katie's point is a good point. Federal regulation, federal law, state regulation, state law, because they disenroll, indicates we're not obligated at that point, but we always try.
I have a legislative question, and that is, does anybody know whether using the VTVLC plan or doing distance learning will affect the ADM?
No, it will not. They will stay. Those students will stay enrolled, and our ADM will continue. From a legislative standpoint, Elizabeth, there's some talk that the legislature, who's going to reconvene, I think in the next week or two, they're considering legislation to hold ADM harmless to all of this pandemic craziness. So I think that's the hope. But the VTVLC 100% remote kids will be counted in our ADM.
Okay, thank you.
Mark had a comment that I'm going to read. And then after I read that comment and perhaps get a response, Anne Marie, you're next. So Mark's comment is, equity aside, have we expressed to parents that we can effectively accommodate distance learning, that this would benefit the more vulnerable population by limiting total exposure? Are parents aware that we would be offering remote learning to those who are school provided remote learning as opposed to an AOE homeschool plan?
I mean, Angie, you can correct me on this, but I think our parents certainly have been informed that there are those 2 options. Our next step, though, for those who want to do a remote option, whether it's AOE or not, and anybody who requests it, they're going to get more detail on that remote option, and at some point really soon, they have to make a commitment to that remote option. I'm thinking by sometime early next week, because we have to staff that option, and we have to work within our schools to then staff those positions who are going to teach remote. We think we might be able to do it within our existing staff, but until we know the exact number. But I think, to answer Mark's question, yes, I think they know that distinction.
Okay, Anne Marie.
I'm wondering, I have 2 things. One, I want to just clarify Mark's thing. I think what he's asking is, have we expressed to parents that it would be helpful for them if they can do the remote option to do it? So we would have less parents, less kids in the building.
That was my intent with the question. Sorry.
Okay, yeah. All right. Yeah. Thanks, Anne Marie, and thanks, Mark, for that. But no, we have not stated that to parents, and I don't think we'd want to influence them that way. I mean, if 100% of our parents wanted to return, we would. Our plan can handle 100% of our parents. Does the remote option help lessen the numbers in the building? Absolutely, but I, Mark, to be perfectly honest and transparent, I would hate to, encourage parents for the benefit of those who are staying in school. I mean, I know that's not what you were saying, but no, we never did that.
Okay, well, I mean, I guess that's why I began it with equity aside.
Right, I got you.
I mean, I know it's not fair, and it may not necessarily be feasible, but the total numbers in the school, if the parents can accommodate it. So thanks.
Thanks. No, I got it, Mark. Thank you. Sorry, Anne-Marie.
Anne-Marie, did you have more?
Okay. Yes. I'm just wondering, so will we be forcing some teachers that would rather not come back to come back? Or will there be the option to do the remote teaching if they wish to, not just if they have to because of a personal issue, but like the one teacher had said her husband has the problem, so she can't get the ADA. You know, are we taking that into account, and are we trying our best to match up remote jobs with those teachers?
Yeah, we would certainly, we've talked about this as an administrative team, and we do have, I think, 3 or 4 ADA applications. Some of those have been responded to, but that would be the list we would go to first, those who have applied for those accommodations. But I think what Keegan earlier was saying is that an ADA accommodation has to be for you. It can't be because you have an elderly parent or a child who has a compromised immune system. And to be perfectly transparent and honest, we will not have accommodations for them. And even though they're fearful and anxious, they would be, required to report to work depending on the vote tonight.
My question, similar to Anne-Marie, just more clarifying on that. If the numbers of remote students required more than the 4 ADA approved teachers, could some of our teachers possibly move into that area?
Yes, there'll be if I understand your question correctly, Amy, and Angie, correct me if I'm wrong, because you had that committee meeting today, that if we have more requests for remote than we have ADA, teachers to do remote, there is going to be a protocol in place where we could extend that. There'd be an application process and then we would, of course, we'd ask for the rationale. We'd go through that. In the end, if everything were equal, we'd probably lean on seniority. Because seniority is a good mechanism for choosing people, choosing among equals, and then also with seniority, you'd probably be dealing with the most senior teachers who are also of an age where they may be more vulnerable. So we take all that into account, and we do think, by the way, that we're going to need more teachers than those 2 or 3 or 4 who have initially applied for ADA accommodations. So Angie's working on a process to make that happen.
Thank you. Are there any other board comments before I take a roll call vote?
Yeah, Amy, let me make one more comment about that, because I just want to make sure I don't mislead at all. If you noticed in the data that Angie presented, there were over 60 teacher respondents that had real high worry and anxiety. I will tell you that we will not have enough remote students to handle all of those teachers who expressed that anxiety. So, and I think you heard the courage on the phone today. I mean, they're gonna follow the board's lead. They're gonna follow our lead. I think you heard them all say that they trust the process, but I don't think anybody will, and again, you could have an ADA accommodation in October, because all of a sudden you get diagnosed with something, a compromised immune system, that it's not like all the ADA accommodations are going to be dealt with by the start of school. It could be ongoing, but we could not meet the needs of all those teachers who have expressed worry and anxiety. I just want to be clear about that.
Thank you, David. Any other comments? So all those in favor of beginning school September 8th with a in-person hybrid, as well as offering remote learning to those families who request it, say aye. and I'm going to start with Elizabeth.
Darn it.
I know. You're the first one I saw.
You happen to be in the top left-hand corner.
Aye.
Chris.
Aye.
Okay, hold on. Nicole.
Aye.
Sean.
Nay.
Anne Marie.
Nay.
Scott.
Aye.
Colleen.
Aye.
And let me see, where'd I go? Beth.
Aye.
Nancy.
Aye.
Mark.
With regret, aye.
And let me see, I'm missing someone.
Bill is not here.
Bill
Bill
is
is
not in
not
the-
here. Oh my gosh, Bill is not here. Okay. So it's up to me.
Yes, Amy, you got it.
My vote, mine, I am going to say aye. This vote was 1, 2, 3, 4, 5, 6, 7, 8, 9. 9-2 in favor of school starting September 8th in a hybrid with 100% remote for those families who are requesting. And we are going to be holding, or also requesting that our administration keep a very close eye and to have those conversations the afternoon of that first day of school.
Yep.
And that we probably even should have a meeting on September 8th.
That would not be a bad idea.
Yeah.
That would not be a bad idea. I think I feel the authority of the board to make a decision even on September 7th if we have to. I mean, I think what I want to say to the staff members who showed up, and I know the board does too, your comments did not go unnoticed, and I want to assure you that with the backing of the board, we will not go a minute longer than we have to go if we can't do it safely. So and I appreciate the time and energy that everyone has spent, moving this forward. It's incredible hours over the summer for people who don't get paid necessarily in the summer. So again, I thank you, and I thank the board. You could sense as you went around the room the struggle with this. So I really appreciate the sincerity and seriousness with which you voted tonight. And I think a meeting on the 8th would be great, a good chance to debrief, and we can get that scheduled.
Okay, I saw 2 comments from Weathersfield that Weathersfield has their meeting on the 8th.
Oh, okay.
So perhaps on the 9th.
The 9th would be good.
We also have our next meeting, and Chris, I see that you want to speak. I'll let you in just a moment. We have our regularly scheduled meeting. Oh, geez, I don't have a calendar in this room. What is the fourth Monday of August?
24.
The 24th, thank you. So that will be our next meeting. At which time, if there are any concerns, if there have been any sort of changes.
That's a good point. Yep.
Locally or statewide, we will have a better idea. I mean, it could change. The decision that we made today could absolutely change between now and September 8th. But our administrators and our teachers also, and our families also need to prepare, and they can only do that if we make that decision now, with the understanding that things could change. So our next meeting will be on the 24th. Chris, go for it.
I'm going to get that invite out right now.
Okay, I just wanted to acknowledge all of the people that have been working on this whole process for an incredible amount of time on in some ways a no-win possibility to try to come up with the best, safest plan that's feasible. And I really, really want to acknowledge people for all of the work, the administrative team, the teachers that were involved, everybody that was involved in this, getting it this far. And I know you're not done, and I appreciate that you're still working at it. And I just wanted to acknowledge all of that. Yeah, that's it.
Yeah. Thank you, Chris. I also, I want to thank all of the board members who have gone to meeting after meeting after meeting, because it's not been easy, and we have had to, I don't know about the rest of you, but I know that I'm up at 2 in the morning thinking about this, and I lay down thinking about it. I wake up at 2 in the morning, and I wake up at 6 in the morning thinking about this. So it has not been easy. We're all working together, and then we go to meeting after meeting after meeting. So thank you to everyone. I want to thank, I think at one point we had 77 people attending our meeting. I hope people felt a little bit more heard. I want to thank Elizabeth and Nicole for assisting with the chat and for keeping time. I hope that it didn't feel as frantic and kind of hectic as the last meeting when we had 56 people. But I want to thank all of our public and all of our teachers who came to this meeting and who spoke and shared their thoughts, concerns, and their emotions with us. I understand, and believe me when I say we have all been emotional over this. And so for our next meeting on the 24th, we will revisit this, just kind of to see how the plans have been working. We will also have our social media policy, because that has not gone away. And we can have the second reading on the policy of teaching in times of COVID. Were there any other? I think that will be a really full meeting.
Yeah, that's good.
All that we want to discuss with the social media policy.
Yeah.
Scott, did you have something more?
Thanks a lot, Amy. Yeah, it's exactly what I wanted to say. I wish we could get some material passed out about that social media policy that the School Board Association has recommended as of June 25th this year. It's one to consider, that we should consider at the same time that we should consider the draft policy from Weathersfield. And I wanted to also say, like Chris did, how much I appreciate the school leaders that are here tonight and the teachers as well, of course. I don't have kids in school anymore, and I treasure moments like the times like the last few hours of hearing from all the employees in the school district and all the different parts of the school district operations. And you know, we have a complicated system here, and we should not forget that you know, that we have a lot to do with that. But you know, and what we expect from these leaders, I mean, it's just, if you just think of the regular board meetings of 3 districts and a supervisory union once a month, you've got 4 of those, and that's if everything is just kind of easy peasy and nothing extraordinary. And that's just not the moment we're in any shape or form. And so it's been more meetings than anybody can keep track of. And we're doing a darn good job working together, I think. We could streamline it more, but mechanically, but you know, as it is, I appreciate it. I feel heard every time I'm here, and thank you.
Thank you, Scott. It is, what time is it? It's almost 9:30, quarter after. If no one has anything else that they want to add to the agenda for the 24th, I will take a motion to adjourn the meeting.
So made.
Is there a second?
Second.
Nicole second. Chris made that motion. Nicole second. All those in favor?
Aye.
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 Aye. I want to thank everyone for coming out tonight and for having this very hard, emotional conversation, and for listening to everyone. Thank you. Have a good night, and we will all be in touch. Bye-bye.
Thank
See
you,
some of
Amy.
you tomorrow. Thanks.
See you later.
Bye.
See ya.